I am really excited today to talk to Dr. Becky Hosey, we are gonna talk about Sjogren's. We're gonna talk about medical gaslighting, her story. I'm really excited. So welcome.
Thank you so much for having me.
I'm excited. I met you at the Autoimmune Summit last fall of 2023. So just a little shout out to those kinds of educational events from nonprofits are so great for getting the community together and learning from each other. But first of all, I want to know a little bit about you. Where do you live and what is your relationship to chronic illness? Although I already kind of gave it away in your introduction.
I live in upstate New York and I have Sjogren's disease. I am also a medical provider. So I'm a chiropractor times 20 years and a physician assistant times 14. So I also have experience with chronic disease in the medical realm as well as a provider.
And that's so great, having both the inside out view of the healthcare system and the outside in. You would think that would make it easier for you as a patient, but as we'll see, it doesn't always. But I actually, before we move on to your personal story, can you explain what is a physician's assistant, also known as a PA?
Sure. So a physician assistant has 2 years of really intensive training. Bachelor's degree, of course, with pre-medical sciences, biology, chemistry, physics. And then they go on to a 2-year program, which involves both academics as well as clinical experiences. And at the end, I received a master's degree. There are some doctorate programs and we actually can practice medicine. Of course, we are under the supervision of a physician, but we actually really have the ability to move and work in multiple different specialties. So, actually, what's great about being a PA versus a medical doctor is the flexibility. So, if I wanted to work in, say, pediatrics, and then I wanted to work in cardiovascular surgery, I could just go ahead and make that adjustment.
Yeah, and I think it's really good for patients to know that when they see that designation, like physician assistant, it's not the same. Like the word assistant doesn't mean like that it's an unskilled, like it is a skilled, licensed profession. I'm sure you have to do continuing education, you're licensed with your state, stuff like that, right?
Absolutely. And, there has been a change, either as physician associate or physician assistant. So I
Oh,
still kind of go by physician assistant just because that was my designation when I graduated. But physician associate is also an accepted term.
Oh, that's really great. I didn't realize there's so many. Oh my gosh, we could talk all day long about words and like the different meanings, how like we have talked numerous times on this podcast before about even just the word arthritis and how misleading that can be. And so, or occupational therapy, we don't just do jobs, but I do really want to. I'm getting better at being linear and following my outline here. So, I really would love to know a bit about your diagnosis story slash saga. What were some of your first symptoms and how did you eventually get your diagnosis of Sjogren's disease?
Sure. So it was a very convoluted one. Um, let's just say that. So I was working as a physician assistant in interventional pain medicine. That's where most of my clinical experience actually lies in that field. And in 2015, when I had just turned 37, I developed fatigue, muscle weakness, and joint pain. And the fatigue was it was so profound. I did what we're all supposed to do, which is call primary care. And I went to primary care. I was diagnosed with some unspecified viral infection. I was given kind of, the really standard instructions, rest, fluids, etc. Call back if you're not improved. The issue became when I actually got worse and not better over weeks. I returned back to primary care, and the primary care provider um, actually dismissed me. She said to me, "Did you follow my instructions? I cannot believe you're not better." And I'm thinking, wait a minute. I was so taken back. I mean, I was just floored. Here I am, this well-respected health provider in the area. I'd only met this primary care provider one time several months before when I established care. So this was like my first kind of, say acute visits with her. but totally changed. I mean, from the initial visit, I mean, she acted like I was, putting her out, like it was an inconvenience for her to see me, and I was not better.
Oh,
So yeah, she
I'm so sorry you experienced that. And I just want to pause for a second to, acknowledge how difficult that experience is. And I know people listening, oftentimes you blame yourself already, before coming into the appointment. And then to have your provider who's in that position of power, even though you are also a health, provider as a physician's assistant slash associate, in that context of that appointment, you are she's in the power position because she has the power to diagnose you in that relationship, and to say that you're not, because the fact that your condition isn't better means that you must be doing something wrong, or maybe you're lying to me. That's just such a what would be a good, what's the word for that? It's such an unjust way of looking at it. So I'm sorry you had to go through that. You didn't
yeah,
have to. I'm sorry you
exactly.
did go through that. Yeah.
It just floored me. I could not believe. So I thank goodness I have this medical education. I said, can you please order this test, this test, this test? Because she really wasn't going to order any tests. And of course, just generalized labs came back abnormal. My white count was elevated, my platelets were elevated, my sed rate was elevated. And but following up with her, she still didn't believe me, even though I had this objective data to say there's some kind of some kind of inflammation going on, right? So we know that most diseases, the underlying cause is actually inflammation. So, I mean, we'll say non-specific findings, but some findings, right? Some objective findings. But I mean, I had to claw and fight to get referred to other specialists. And finally, one visit, she said to me, "You don't look sick, and I don't think you want to get better." And I can't even make this up, really, honestly. And
I just hurt my jaw, dropping my jaw to the floor.
yeah,
Literally.
yeah, I
Wow.
basically would not cry in front of her. I walked out of the building, and tears started streaming down my face. And at that moment, I will say I had a pity party. But it was, sad for myself, but within probably, I don't know, 30 seconds, a minute, it was like collective sorrow. And that was even more emotionally overtaking. I was just sobbing, like standing next to this tree, like leaning against this tree in this parking lot, because I thought about all the patients that are way more disadvantaged than myself, and how are they successful navigating when here I am, this, kind of higher up on the food chain, in the medical food chain kind of person. I mean, I know the inner workings, I know what tests to ask for, I know what referrals to ask for, how do others much more disadvantaged navigate successfully? And, the answer is they don't. And I felt this sadness, and I knew at that moment I wanted to, well, first I said, I'm going to figure out what's wrong,
Mhm.
and I'm going to help others. I'm going to write a book. I'm going to do something. I didn't know exactly how that was going to take shape.
I mean, that's incredible, and I totally agree with you. I mean, the reason that autoimmune illnesses take on average, I always butcher the statistic, but it's something like 4 to 6 years to diagnose. It's worse if you're a female, it's worse if you're younger. And, I think providers, it's easy to have an us versus them mentality and say like they're all mean and they all hate us. And in reality, medical providers like yourself are probably often taught, and like myself taught, if you hear hoofbeats, think horses, not zebras. The most Occam's razor, is that how you say it? Occam's razor.
Yes.
Yeah, the simplest explanation is the best, and that's not true for everyone, and the reality is so much messier. And no wonder, I mean, there's someone asked me once, did you, when I was pursuing my diagnosis, at that point I was only 20, I never had any health issues before. Just I was used to blindly trusting doctors, and that was what was so cognitively dissonant for me, was that I'm like, doctors help people, I'm not being helped. But I can't reconcile these two because I wasn't willing to, I didn't want to believe that doctors could be so unhelpful as they were. Like something is wrong. I can't figure out this problem. And I kept saying it was like, my body's on fire. And I called the firefighters and they're like, my diagnosis is your body's not on fire. And like, you're nothing, there's no fire. And you're like, but I know there's a fire, but I also respect you and you're telling me there's not a fire. So it's a very, yeah. And at your stage, you had been a healthcare provider for over a decade. So maybe had you already been introduced to the concept of medical gaslighting at this point, or seen patients in your pain clinic that had kind of gone through something similar?
Yeah, great question because have always been very compassionate, very empathetic, but honestly, I just did not get it until it happened to me. I didn't get it. Yes, I saw patients, for many years as both a chiropractor and a physician assistant that, would tell me like my doctor's not listening to me. And I guess, I just did not get that until I myself was the vulnerable patient. I
Mm.
did not get it.
Well, that takes a lot of, I would say, vulnerability and humility to I don't want to say admit that, but to acknowledge that. And I don't know if this is going to sound like the weirdest analogy, but I feel like it's kind of like we all think we would do it differently when we're looking at someone else's experience. Like, I'm literally watching the Olympics. Like, if I were or watching, let's say a better example would be like American football. I was watching last night and I'm like, I would go this way. And I'm like, what am I talking about? Like, I would die if I was trying to play. I get tackled and die. Like, why do I think? But it's like our brain's way of protecting us to say, well, if I or my medical training would have protected me. My communication skills would have protected me. So I think in a way, it's almost so scary for us to confront the randomness of life that it's easier to say, well, it wouldn't happen to me. So you didn't get it. And then there's a saying in chronic illness, you don't get it till you get it. Sounds like that resonated.
Exactly what happened.
How did you eventually weasel your way into rheumatology? Is the rheumatologist who diagnosed? I'm saying weasel as sarcastically, meaning like you had to really advocate to get yourself there.
Oh yeah, and that is a whole. I mean, how much time do we have, honestly?
Yeah, but I wish sadly, this could be like a 24-part series. Yeah.
Definitely, definitely. So my primary care provider refused to refer me to rheumatology, even though I had seen like 10 other specialists and just my medical knowledge. I said, no, I got to get to rheumatology. So I did weasel my way. That's a good word to get an appointment without a referral. So yes, I did. I told the receptionist a little too much about my life, I'm sure, on the phone. Physician assistant, have trouble working. I'm having these symptoms. My SED rate is 70. I need to come in and be seen. So, but I still had to wait months to get the appointment. And I know this irritated the primary care provider very much so. But in any event, I'll just give you the quick synopsis. When I showed up to rheumatology, that was an unbelievable experience. And I was so medically gaslit there. So I don't know if you want me to stop and just define medical gaslighting.
Oh, yes. Thank you for remembering. I was saying before we started hit record that maybe we should define it for people who haven't heard this phrase before. What was your definition?
Sure. Well, gaslighting is psychological manipulation. Okay. And in the medical realm, this can take place as a provider basically discounting the patient's symptoms, making them believe that it's all in their head. So we can kind of get into some of the causes of why I believe that occurs.
Yeah, yeah, and I
But
just one thing is I know some people who are literary, or what's the word, who are really into the like official meaning of words. There's a little bit of a debate in the field around in the medical field in the chronic illness world around the word gaslighting. Originally, gaslighting meant a psychological technique that was overt and intentional, where you intentionally, what reality is, you as a manipulator know what reality is. And you say, I'm going to make this person think that they're quote unquote crazy by telling them the reality is not true. Whereas in the difference in I kind of call it sometimes unintentional medical gaslighting, because I think most providers are not evil manipulators who end up contributing to medical gaslighting. They truly think you, Dr. Becky, were not sick, or me, Cheryl, was just an anxious 20-year-old type A person. So they're, if they weren't like, she has rheumatoid arthritis, but I'm going to tell her she doesn't because I'm evil. They're kind of saying, they're like, no, when I heard hoofbeats, I think horses, not zebras. She looks fine. She's a 20-year-old, talking about myself. And she's losing weight. Oh, also, the other one for me was a trigger warning, eating disorder. So they thought I had an eating disorder because I had severe muscle mass loss from rheumatoid cachexia. So I went from 130 pounds to 105. They told my parents, they called my parents behind my back and said she's hiding an eating disorder, when I had never had any history of an eating disorder or obsessive, behavior around food or body image or anything like that. In fact, I was starving, but my body wasn't retaining the food, long story short. So yeah, that I still think that the intent or the impact is that the person feels gaslit because their reality is being discounted. You as the patient are saying, I'm sick. Doctor is saying you're not sick. And I'm the one in the position of power to determine whether you're sick or not. So what I say goes.
Right, right. So yes, so let's talk for a minute about consciousness versus unconsciousness, right? Or,
Oh yeah.
these providers are just part of like the system, okay, that's broke, that's fractured, the health system. Okay. So yes, exactly. So I do believe that most providers go into medicine for altruistic reasons. I really do believe that. But I do believe there's some corruption of these providers along the way because of all the constraints of this fractured medical system. So, I mean, really, I do believe there are um, two major kind of components to this behind this medical gaslighting. One of them being society's influence on medicine. So society, has always had an impact on medicine traditionally, the toxins of society. So what's happening in society, all these intolerances, the biases, prejudices, this is all happening in medicine, all of it. And, that's very rarely spoken of. Those particular intolerances and those particular cultural ideals also lead to a lack of research. So, for instance, we'll just take, autoimmune disease, right? Sjogren's is in most autoimmune diseases are female dominant. Okay. And Sjogren's, right? The average person is a female, 90% female. They are diagnosed 40s to 50s, so middle age. All right. So I don't have to go into kind of how middle-aged women are viewed in our culture right now.
Mhm.
So you can picture that there's crumbs of research, right? So
Yeah.
crumbs. So when a female presents to the doctors complaining of joint pain, fatigue, the provider, first of all, has a lack of information. Okay, they have a lack of information. And maybe they also have their kind of like internalized kind of intolerances, internalized kind of things. So not vicious as far as, yes, like what you're saying, like, is this a conscious thing or an unconscious thing, right? They're falling into this routine. Add that with the transformation of medicine, right? The corporatization of medicine, which is a fancy term, just means that these non-medical corporations are buying up these medical facilities, these medical businesses. I mean, we rarely see these mom and pop little shop, small kind of businesses where you get more personalized care. And now these providers have so many constraints. So yes, we'll just say fictitiously, Mrs. Jones shows up, right? And Mrs. Jones is complaining of the same things I did that I had. All right. So fatigue, muscle weakness, joint pain. I also had dryness. Um, and now you have a provider that's overtaxed. So they are seeing too many patients in a short amount of time. They have a lot of administrative duties. Their autonomy is gone because of this corporatization. And they also don't have information because there's a lack of research. That will just elevate the chances of medical gaslighting. So yeah, so I don't
Wow.
necessarily think it's a vicious thing. I think it's also this kind of cyclic issue that honestly we could spend probably, like you said, 24
Yeah.
sessions talking.
Yeah, no, I love how you wove the 20,000-foot view into it, because you're right. The patient, or me, when I think of my own history of medical gaslighting, I kind of get fixated on the individuals and think, if I could have just told them, if I could have just said something different. And it's important when you're looking at maybe solutions to this or root cause analysis, what caused that what larger in society caused some of these things? And you're so right. It's the profit-driven corporate healthcare system. That's never gonna A profit-driven system is never going to benefit the people with chronic illnesses, because our illnesses are expensive to maintain. They want to just get us out of their way, give us as little as possible. And the societal they just started in the American College of Rheumatology, or sorry, I should say, I just became aware that so maybe they started this like years ago, but I don't think it was done, let's say in the 90s, a whole area in the annual meeting, the annual conference, ACR Convergence, is a whole section of the program called social determinants of health. And it's looking at racism, sexism, ableism, and socioeconomic status, rural versus urban splits, all things like vaccine hesitancy and what contributes to that. And so anyway, I'm just rambling, but I'm trying to kind of um just reflect on these societal issues that lead to gaslighting.
Yeah, exactly. And I think many medical providers are really great about treating the acute, right? This
Yeah,
diagnose, treat, cure that's like nailed in all medical education.
yeah,
Okay. But what happens when the patient doesn't get better, when they still come back with the same complaints like I did?
yeah.
When they're not, when there is no cure. So how is that handled? And I think really medical education, from students all the way up to the most seasoned practitioners, I think there has to be a reform, and I think that practitioners need to be educated. And it's one of the things that I do is I go into these medical programs, these medical institutions, and I talk to these students of medicine. I tell them my story, and we talk about solutions.
You totally anticipated my next question, which is like, what are the things we can do to combat medical gaslighting? We are going to go back to that point where you actually finally got, this is the summit of the mountain of the diagnosis hero's journey. But yeah, so stay tuned for more. But yeah, so to combat medical gaslighting, having more of this information in the medical education, even naming it. I think there's just such a power in naming. I didn't know what gaslighting was. I never heard the phrase medical gaslighting until I had been active on social media. And once I heard that phrase, it like unlocked something in my brain. And I even talked to my therapist about it. And I was like, this makes me realize, again, it made me realize it's just more of a universal experience. It's not just me. Like I kept thinking, because of wanting the illusion of control. Well, if I was too deferential to authority, I didn't advocate for myself well enough. Maybe that's why. Better education on the provider side. I was also thinking, what do you think about this? This is a half-baked thought, so feel free to contribute to it or say no. But I've done a lot of work on like acceptance and commitment therapy, which is the therapy approach I find most helpful for living with chronic, unpredictable, disease. And one of the things that you're encouraged to do in that framework is like accept uncertainty and accept that like life isn't black or white. And I feel like that's so antithetical to how medical education is. That's all because the medical education, like you said, it's diagnose, treat, cure, but fix stuff. And it's very threatening to people who are used to fixing to be faced with a problem that they can't fix. So I don't know what that would look like other than I think teaching the medical students and the medical providers, like saying out in the open, sometimes you're going to be wrong. Sometimes you don't have enough information to make the perfect diagnosis. And that we need that to be a situation that is that is met with like your own self-compassion rather than your coping mechanism being blaming the patient or blaming you know what I'm saying? I don't know.
Yeah, absolutely. So like I said, I do have this unique perspective, right? So as a provider, I can tell you that we do have a lot of pressures to get it right and get it right the first time. Okay. So there's a lot of pressure on us. All right. So time is money. And we're, we're really pressured. So when I talk to these students of medicine, I say to them, it's okay to be wrong. It's okay to not to have an answer. And it's okay to just validate the patient's concern validate them and say, I don't have the answer, but I will try to find the answer. I'll try to get you to the right person. There's that investigative part, right? We're really detectives. And, if the system keeps putting all these constraints on us, right, taking away our time and putting all these pressures on us, again, medical gaslighting is just going to continue to flourish. However, honestly, if we just sit with the patient and really say, I don't know, but I will do the investigation. I will talk to, team. Really good medicine is team oriented. So I will talk to a colleague. I will, try to help at least get you somewhere to get this figured out.
Yeah, I love that. I think that I'm gonna just bring up that in my own therapy at one point, my therapist was like, I literally, I'm trying to figure out how to condense the story, but I was teaching at an occupational therapy assistant program, and I was struggling with a lot of anxiety around not knowing all the answers. And it's one of those things where when you say it out loud, you're like, well, I guess no one knows all the answers. But I was still struggling. Like when a student would ask something, I always felt like I had to have an answer. So he's like, your goal for therapy this week is to say the words like, I don't know, to in front of your whole class that you're teaching. And that was really hard for me. And it wasn't just like she's a know-it-all, but it was like it's threatening to feel like it's like anxiety is the antidote to anxiety is like black or white answers, right? So saying I don't know and living in the uncertainty is the hard part. And I think maybe teaching providers, like I don't know if there's ever a point in med school or PA school where they're taught it's okay to say you don't know. It's okay to say and to say and I think that we also need, this is where it gets a little tricky because I facilitate support groups for people with inflammatory arthritis, and a lot of times I'll hear the patients say things like, well, the doctor didn't even know, or the doctor said that they had to ask someone else. And they're like thinking that this is threatening the doctor's authority. And so we also have to educate them to be like, these are not like easy diagnosis. It's not like, a giant mole on your face that's like, I could look at that and see that you have skin cancer. It's not like that. And so it's actually the mark. I'll tell people it's a mark of a good doctor when they say they don't know. Actually, it's not a sign of a like bad doctor.
Exactly. And when I also lecture to these students, I make that point, where it's okay, and your patient will respect you enormously if you say, I don't have the answer. I have to, really look this up. And I think maybe as a provider saying, there isn't a lot of research on this, there's not a lot of information. So this is why I don't know. This is why I'm gonna go look it up or ask someone. But honestly, just really, I think just that rapport, okay,
Yeah.
this sacred trust that you have, this provider patient relationship, this connection, and how a lot of the medical system failures just destroy that.
Yeah. I remember the first time I'm just thinking of little quick phrases we could teach the providers to say or, have them practice or try. And one of them for me was just like, wow, you've literally the validation, like you've been through a lot. That's a lot. I remember the first time it was actually a physical therapist. So I'm an occupational therapist, which is a separate field, often confused with physical therapy, but we are different. So, like different licensing, different tests, different scope of practice, they do overlap, but they are officially different. And so this was a very expert, very experienced one. And I kept minimizing the time, well, but this, and then this happened. And he's like, you've been through a lot. And I will never forget that moment, because it was just like, it wasn't just that he said that I could tell he was attuned, he was listening, he was present, he believed me, and it's like every time a bell rings, an angel gets his wings. Like every time a doctor believes you, like it heals someone who's had medical gaslighting.
Yes, exactly. And I think that's a great point is, we're always as medical providers, we're always trying to fix everything, but it's okay. It's okay not to fix everything. It's okay. So just, sitting with the patient, validating them,
Hmm.
and really just, asking them questions, how their disease impacts their lives every day, really connecting.
Yeah. Yeah. And and again, that's the time that we can spend with the patients has been so eroded over, due to like, again, that profit incentive but it doesn't take, I would argue that, you really can be present in even a 15-minute encounter, So, um, the other thing that I am curious your opinion on, I've tried over the years um, to kind of suss this out. I almost feel like I need to talk to like a lawyer, but the thing that I find really frustrating about medical gaslighting is like in the legal system, it's like you're innocent till proven guilty, right? It's like absence of proof that you murdered someone doesn't mean that you murdered them. It means we don't have proof. But it feels like if I present to if a patient X presents to a doctor with this kind of diffuse set of symptoms. It's unclear. Like I have joint pains worsening in the morning. It's bilateral, but like my sed rate is looking good. And like all these other blood markers aren't really clearly off the charts yet. It's like so often well, we don't know for sure what's going on with you. So most likely you're just anxious or you're just you know what I'm saying? It's like, why, like it would have been such a different situation if when I presented with all of my systemic symptoms of rheumatoid arthritis and then the one joint that was sprained, I'm making air quotes here. I had a sprain, now as a college athlete, like starter, all conference pick as a defender. Like I was not somebody who was going to be on my laid back because of one finger that hurt. Like that was the very least of my worries. Now, of course, I now know that was my first symptom of rheumatoid arthritis because it was hurting for like a year, but I was like, whatever, who cares about this? And so it's like, if they had said like, look, I believe that I believe you, like literally the words, I believe you, like this, you have a lot of mystery things going on. Like I did also have like really dry eyes and I had unintended weight loss, weakness, fatigue. Um, and I was anxious about that. And it was like all that they cared about was you're anxious. You must be just anxious. You have health anxiety. You're a hypochondriac. If they had just said like, there's no other real explanation I can tell for what's going on with you. Like, I believe, and like, no wonder you're anxious. Who wouldn't be anxious? You know what I mean? And that conversation could have been so different, even if they had no answers, no diagnosis, just being able to say, I believe that you're really hurting. You are sick, but we don't know why and what it is. It could be a little virus that it's going to be gone and you're going to feel fine in a week. You know what I'm saying? But I don't know. Um, if that's like too difficult of a conversation, why isn't that the default to say like to believe patients rather than jump? I just personally believe there shouldn't even be a diagnosis of hypochondriac because I think it's like the death penalty. Like if you can't be sure that that's what it is, then we shouldn't do it. But I don't know. What do you think?
Yeah, exactly. So I think, we need to humanize medicine, and that's exactly what you
Yeah.
explained. Okay,
Yeah.
so the patient has definitely fallen out of the center of care, which just is so paradoxical. It doesn't even make sense to say those words together. Okay, but really, we need to rehumanize medicine. I mean, many of us can remember a time when medicine was so much more personalized, right? So much more personalized, and again, I think this corporatization really has affected that. You walk in, the receptionist knows your name, the nurse, they know your family, it's just it's so depersonalized, and really we're losing the humanity. We're losing the humanity. And
Yeah.
I do want to say, Brene Brown, this wonderful social scientist. I don't know if
Yes.
you've, oh, love, love, love. She has a quote, and I don't want to say for, exactly, I'll just paraphrase it here. Um, about really true empathy is believing what someone tells you and seeing it as they see it, not as you see their symptoms. So, and I give this example to the students that I talk to and say, listen, your patient X may come to you and they may have a sore throat, but it's nothing like what you've experienced before. And it's nothing like what patient Z has experienced before. So it's really important to accept what they're telling you, accept it, believe it.
What's been the response when you've gone to talk to medical students about this?
Yeah, I wasn't sure at first.
Yeah.
I wasn't sure, but honestly, the response is, it's been very, very positive. it's amazing. I have a line of students like every single time after I speak that come up to talk to me, and many times, actually, I should say, basically at every single lecture that I've done, I at least have one female that says I'm being worked up for some kind of autoimmune disease, you know. But really, this is so positive, and I know we've been talking about a lot of negative, so I am so
Yeah.
glad that I have the chance to interject this. They know the system is fractured and they want to change it. They do. They want to change it. And the thing is, if my story touches even just a handful in a group, like last month I talked to, I think it was 69 students. Um, Honestly, if I just reach just a handful, think about how many more patients they'll see over their career versus just me seeing my, X amount of patients per week. So I really feel like I am changing medicine a
Yeah.
little at a time.
Yeah, and that's why storytelling is so, as humans, that's our primary historically mode of communication, is sharing stories. So I think, yeah, I'm excited for your book to come out. Putting a plug in. I haven't even read it, but I just trust, just having known you, that it's going to be amazing.
Thank you.
But I don't want to forget to get back. So were you still gaslit at the rheumatologist or no? Did they
Oh
actually?
yeah, it was.
Oh my god,
I don't
no,
know if you. I'm not
no.
really sure if it was worse than the primary. I'm not really sure. You'll have to read the book and decide for yourself.
Um,
So yeah, so it had been 7 months now since I had these symptoms. And the symptoms were just getting worse. I mean, I could work very just sporadically. Say I'd work for a day and then I was out for like 3 or 4 days just trying to recoup. I was honestly like dozing off at the wheel because the fatigue was just so severe. I sometimes needed help like walking to the bathroom, just
mhm.
ADL stuff, like washing my hair. I mean, just unbelievable at 37.
Oh,
Um, so I
sorry.
walk into this rheumatology. So here I'm so hopeful, and I really believe that the answers are going to be revealed. That this was such an important, just a pivotal, because I'd seen 10 other specials. So so I had these two index cards, and one index card had my symptoms front and back, and the other index card had um, my symptoms matched with tests for diseases that had been yet to be ruled out. And I walked in with also a binder of my medical records. See, this is all, and again, because I'm blessed that I had this ability to put this all together. It was in chronological. It was very, very organized, and I was just, again, ready to just make this a very efficient visit. Um, and sorry, my dog is barking.
Oh, that's okay. I can't hear it.
Okay, all right, sorry.
No
That'll
worries.
have to be edited out. But
No
anyways,
worries.
so I go into the examination room, and as the door opens and the provider comes in, it felt like the air just deflated. And I started to talk. I said, I'm a physician assistant. These are my symptoms. And she just interrupted me. She would not let me speak and said, I reviewed everything from primary care and you're premenopausal. She called me premenopausal, which actually is a wrong term to use. I think she meant to say perimenopausal, but I had just had my hormone levels checked, and I literally went in my handy dandy binder and I pulled out the paper and said, no, 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 I'm not actually. All my hormone levels are normal. And she refused to accept the papers. And then, incidentally, I had an ovarian cyst that was found like several months before. And she said, no, it's all because of the ovarian cyst. So again, I pulled out the paper. No, I had a CT scan. It was normal. Refused. And she said, follow up with gynecology. I've already seen them. And said, you don't need any labs, and was going to leave. And this was all in a matter of, I swear, probably like 1 minute. And I was just like, oh my gosh, I thought at least I would be afforded a chance um, to tell, a concise, history, give a concise history. And really just, he didn't afford me any humanity, never mind being, a medical provider, and kind of respecting my knowledge. So um, it was terrible. So make a long story short, very long, I really dug my heels in. And when she said no, like she was getting ready to like walk out the door. And I'm like, no, I need lips. I've been sick for 7 months. And my spouse was there who said, no, like I have to like walk her to the bathroom sometimes. Like she is so sick. Um, so she finally gave in and ordered labs only after she realized I was not leaving. I literally was not leaving. I thought, well, if security has to escort me out, I would learn no more or less about my disease, whatever's happening to my body right now. So
Wow. I
she did
really,
finally.
yeah, I just want to shout out your tenacity because I feel like I'm such a people pleaser that I really would have just been like, okay, and then like just cried. So the fact that you were like so determined, I'm sorry, I'm just shouting you out, but continue.
Yeah, no, I appreciate that because honestly, and I was so fatigued, I don't even know where I got that energy from. I swear, and I write this in my book that I believe it came from my soul. Like I have no idea how
Mm.
I got the energy to I just kept going down my cards and saying, no, I need this because of this. Like when I told her about the dryness, she said, run a humidifier. Well, what, like, of course I've been
Oh,
running a humidifier. Like I can't, like
oh,
my eyes are glued together and I have these patches all over my skin, including on my face that were so obvious, dry
gracious.
patches. So I just went down the list and I just kept saying, I need this test because of the symptom. I need this test because of the symptom. And I just wore it down and I wasn't combative. I was not rude. I did not elevate my voice. I just simply, and I think that's important to say because from a patient standpoint, what can you do when you're being medically gaslit? And here it's so frustrating, right? You're so sick and, it's easy to kind of fall into this confrontational manner, which definitely will make things worse. But no, I just stuck to the facts, stuck to the focus, which was I need to walk out of here with a paper. And I did. I walked out with a lab paper and I walked down the hall and got my labs drawn. And a week later, I got a notification from, I think it was like LabCorp, patient portal with my results. And I remember I couldn't work that day. I was too sick. And I remember exactly where I was when I opened up my laptop and pulled up the results. And yes, I mean, my inflammatory markers, platelets, immunoglobulins, my sed rate were all high, but also these autoantibodies were found for Sjogren's. So the anti-SSA.
Okay,
So
that's what I was gonna ask, 'cause I know people listening are gonna be like, what was the name? What did you ask her for? What?
So, I asked her for a list of things.
Okay, okay.
But, I asked her because I asked her for, the Sjogren's antibodies, I asked her for an ANA, I asked her for an anti-double-stranded DNA, I asked her
Okay,
for anti-Smith proteins, I asked for, just a variety of things, ruling out all these different diseases,
okay, okay.
and especially my uncle actually died from SET55, and I definitely wanted the ANA, and I know the anti-double-stranded DNA, they were so important to me, and of course, she left off the ANA off the order, and when I did not see it on the result, I actually called the laboratory and they said, no, they actually pulled the order for me, which was so sweet. And they said, no, it's not on the order, ma'am. So in
What?
here, I didn't have a follow-up appointment with this woman because she told me the test would be normal, no follow-up. And she wrote that in all caps on my checkout paperwork, no follow-up.
You
So
need like a museum dedicated to this experience to make everyone walk through it and see these artifacts and see like a role play. Like this could be so instructive. Like this is like one of the, I'm sorry to like, we can't really compare disease Olympics, but like this is one of the most egregious examples I've seen. And I've seen a lot of examples, but because of the fact of you being in such a already well-trained medical provider perspective, like there is no excuse. Like that I get a little bit more like, okay, whatever. That there's no excuse for how you're treated. This is I'm like almost speechless, which is like pretty much impossible for me. So okay, keep going.
all right, well, good thing you're seated because I'm not at the summit
Oh
just yet.
no, I
Um,
can't handle it. What? No. Okay, keep going. I
I
want to
had
keep
no follow-up. So I called the office to say, like, she told me nothing would be found on the labs and I have no follow-up. And they said, okay, a nurse will call you back. And believe it or not, the provider herself called me. And she just forgot who I was. Okay. Because I said, oh, well, it looks like I have primary Sjogren's. And she said, "There's no way you have this disease." And I said, "Excuse me?" Like, I again was totally shocked. Even though she was, so dismissive to me, I still thought like, okay, well, we're both scientists and this is data. Okay, this is data and it matches all of my symptoms. And she said, "There's no way you have this disease. Your autoantibodies are not high enough for me to diagnose it." And I'm like, "Okay. So do you want me to go to a different lab?" "No, I can just retest it in 6 months." And I said, "That's not acceptable. I can't work right now. I'm sick." And anyway, so and by the way, my levels were like 4 times the normal amount. Okay. So in any event, as soon as, and she hung up the phone on me because she's like, "I can retest in 6 months. Call me back in 6 months," and hung up. So I thought, oh my gosh, I was so bewildered. I actually went online and I said, okay, and I don't live in a small area. Okay. I live in the capital of upstate New York. Okay. So this happened in Albany, New York. Okay. So there's a lot of people that live here. So I went online and I found out where's the best place for me to go to get diagnosed. So the Cleveland Clinic, great for rheumatology, Johns Hopkins. There's also a Sjogren Center, University of Pennsylvania. So I got a 2 month wait for the Cleveland Clinic and a 3 month wait for the Penn Medicine appointment. So I just had to tighten down and wait for those appointments. In the meantime, I saw primary care back who was like, "Well, she doesn't think you have Sjogren's, and I've never seen anybody with Sjogren's that has anything but dry eye, dry mouth." So I heard that,
Ugh.
and I'm realizing, wow, like I not only have this disease that's it's misunderstood, like in the general public, but also in the medical community, severely
Mhm.
misunderstood. So
Yeah.
I ended up at the Cleveland Clinic, and I ended up getting diagnosed properly. And a wonderful doctor who was so sweet and really just said, "You need to get somewhere where they understand the disease because we rheumatologists don't all understand this." So I went to my appointment at the University of Pennsylvania, and I'm still a patient there. So I just saw him
Wow.
a few months ago.
You shouldn't have to do this though. This is just I cannot I mean, I can believe it because but I also am I'm just again practically speechless. I'm glad I didn't, your book isn't out. I didn't read it yet because this is like for me to learn. I'm like it's like one of those reaction videos, like where people react to like Cheryl reacts to medical gaslighting stories. But I one of my ideas also for combating this is having like difficult conversations with but necessary conversations with the providers who did the gaslighting. I wish I could say that I did go back. I think I did have this was the gastroenterologist in my case that did the majority of the gaslighting. And then my parents had to hire a what was back then called a concierge, or it's a concierge doctor, who also said I was hyper vigilant and too anxious and not really sick, but she would, you know, follow up, she would be there available if I had any additional things, but she's like, "Stop tracking your symptoms, stop thinking about this so much." And so she definitely knew when I got the diagnosis of rheumatoid. It was when I had bilateral joint pain, not just the one finger. And I get that that's like the cardinal symptoms for RA for me. So in your case, there was a lot more objective symptoms a lot earlier. Once I had bilateral joint pain, it was like boom, got into the rheumatologist. My mom said it was the next day, and then she diagnosed me the next day. So, but back to your story, I never went back to the gastroenterologist and told him that I had RA the whole time, and that and so I wish I had done that. But I don't know what it would have done other than, I mean, I do think that providers have to contend with learning. If we never teach the people that gaslit us what our ultimate diagnosis was, then they'll continue just thinking, you know what I'm saying? Like, have you ever done, I mean, it's emotional labor on your part. Have you thought about that or done that or know anyone who has?
So, the primary care, I did continue to see her until December of 2015. So I got sick in February, and my last visit with her was in December. So I think it was either before or after I saw the Sjogren's doctor
Mhm.
specialist in Pennsylvania. Um, and I did say to her, I believe it was right after the Cleveland Clinic visit, and I printed off, the consultation report that said no, she has Sjogren's, and I brought it with me and gave that to her, and she basically said, "Well, I guess you got your diagnosis." And honestly, and I write about this in my book. I really could have been a total jerk to her, and I probably should have been. Okay. But I don't know, I'm not exactly sure why I didn't, really just tear into her, and I really should have. In some ways, I guess that's almost, maybe one of the regrets I have. My spouse says sign the book and send it to her because yeah, I mean, she gave me some great information, great great
Yeah.
information for a book.
Yeah.
But I think I would love to empower patients to, report these things. Report it to,
Yes.
of course, because much of medicine is, corporatized. So, report it to someone
So it's
because yes,
patient
it does.
satisfaction. Like the
Correct.
patient satisfaction scores mean a lot. So being able to go talk to patient relations is usually what the department's called, but also risk management. If you think it's crossed the threshold into a true medical error, being the failure to accurately refer and diagnose, which led to the progression of your disease. That's what's so egregious in rheumatology when this happens, because there's the data for rheumatoid arthritis is really strong. Early aggressive treatment, that is the way to get this inflammation under control. The longer you wait, it's like my rheumatologist says, it's like the fire in a house. If you can contain it when it's just in the front entryway, it's going to take really short amount of time. If you can wait till the whole house is on fire, it's going to take longer. But so it's
Exactly.
actively doing harm to not diagnose. I'm just so they said it's almost like it became a power struggle, like where like you wanted something, they had the power to give it to you, but they're like, because I had already, it's like cognitive confirmation bias, like psychologically that they had already decided that you weren't really sick. They're like, well, I'm not going to give in and give you this thing that you want because that means you win. When really what you're not trying to do is win a power struggle. You're trying to get healthy, you know?
Right, exactly. And we all took the oath, right? Hippocratic oath, to do no harm. First, do no harm.
Yeah.
And that's so counterintuitive to what happened. And honestly, I do believe that it had to be as severe as what it was, though, in order for me to really um take this experience, and I really do. I want to change the way patients are viewed and treated. And I
Mhm.
think it just, probably spiritually or something, I don't know, it had to be this severe in order to really make an impact on telling others, telling these students of medicine that I meet with.
Mhm.
Um, you know,
Yeah. Yeah, I mean, I think that, what I'm curious about is there's this phrase that I learned about in psychology called like stereotype threat, where it's like when you're confronted with a stereotype, it's like that's about your people, whether it's like women or men or whatever, that you kind of uh it alters your performance. And what I mean about what that relates to in this case would be like I'm I wonder psychologically like what the best angle is, because when you take a profession like doctors who are already at all-time highs of burnout, and their job satisfaction is low. I know so many doctors who are like, I would never, I tell med students, don't pursue this. Like, this is not the profession it used to be. Like, my uncle just retired. He's a pediatrician, like amazing, did house calls, like all these wonderful things that you just, now the system is just so broken. So it's like, how do you make a space for them to be like to feel unthreatened by this idea that and not defensive. That's the word I was looking for. Defensive. Like, I don't know. What do you think?
yeah, and I will tell you though that when I do meet with these students, there's always a few that are kind of like, oh, you can just tell
Mhm.
like their faces, as I'm
Yeah.
lecturing to them, like, oh, I don't believe her. Um, but honestly, so between the few, most of them really do, um, they want to make a difference. And I do put a positive spin on it and say, you can be the difference.
Yeah.
And
Yeah.
medicine will change from internal forces and external forces. So externally from patients saying, like, I'm not going to deal with this substandard, I'm not going to put up with this substandard treatment. Okay. But also internally. So what can providers do? And I usually give them the scenario, this fictitious Mrs. Jones. What if you see Mrs. Jones, she's not your usual patient and she's a patient of Dr. X's, and Dr. X is sick that day. So you see Mrs. Jones, and Mrs. Jones tells you Dr. X isn't listening. Dr. X, has been blowing off her concerns, and she's, feels very ill.
Mhm.
And he's making her think it's all in her head. So you see Mrs. Jones and you feel like, yes, I mean, there is some validity, I validate her symptoms, and there is some, data to suggest that we need to move forward with testing or referral or what have you. Are you going to go back to Dr. X, and are you going to say, listen, I saw this patient, saw Mrs. Jones, and she's been saying X, Y, and Z, are you going to do that? So I challenge them.
Mhm.
And, a lot of times they're like, whoa. And, I think when I gave a lecture last month, someone said, well, it depends on, how long I've been out in practice for,
Mhm.
and I said, well, first of all, thank you very much for saying that. That really took a lot of courage to say that.
Yeah.
I wouldn't have said that as a student. I can tell you that. Um, that would have been my response. But really, I want them to start thinking, okay, are you going to go? What are you going to do? What are you going to do? Are you going to intervene when you find a provider not being empathetic? Or what about lunchroom discussions? I know I've been there, I've heard them. This
Yeah.
patient says they can't work, this patient, is malingering, all this. So what are you going to do? Are you going to try to make a difference from inside?
Yeah. Yeah. And that's important to get them so early on in their journey as medical students. I think it's a harder sell to the practicing providers. I'm not saying I'm not trying to be negative. I'm just trying to think like what would and maybe that's a conversation for another day. We talked earlier about maybe having a panel of like people who are both providers and patients to come together and be like, what how can we open people's minds to this issue in a way that's not combative and that is like you said, yeah, it starts with the micro interactions that you have and feeling empowered to sit with the uncertainty, with patients to say we don't know, and 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 that's okay, but I think it's a tricky one, and I do think that especially if you say, okay, well, I know that my little vision of a world where hypochondriac is not a diagnosis, that's not going to happen. So where do you draw the line if a patient is continuing to feel anxious and about their health and they feel legitimate symptoms of pain or fatigue, and you as the provider truly feel that they don't have any organic condition going on, how do you separate or differentiate that diagnosis from the I would argue intrinsically anxiety provoking experience of your body breaking down due to like inflammation, from a festering but maybe not clinical yet autoimmune illness. So it's tricky stuff, but you're right. It starts with sharing the stories. It starts with talking about this, naming it in the open, and also educating patients that this is a phenomenon so that they can be better advocates for themselves. Like you had to advocate every single step of the way on your diagnosis, and despite it being so severe, I mean, the fact that you couldn't do your ADLs, activities of daily living, you couldn't brush your hair, go to the bathroom easily. I mean, that's so severe. It's not like you were just saying, I'm a little tired. So I
Right,
just,
exactly. I mean,
you're,
I was bedridden for
yeah.
times in 2015.
Oh, so sorry. Well, I know that people listening might be wondering, so we got to the diagnosis, but how is your Sjogren's treated today, or what treatments? I know we can't probably go into every single little detail just with time for time's sake, but have you found some treatments that have worked, or what's in your treatment toolbox, in other words?
Sure, and unfortunately, I'm kind of the person that doesn't really respond very well to regular traditional medications. So I've taken medications on and off over the years, really rely on, a combination of anti-inflammatory kind of, diet, exercise. Meditation is huge. I write in my book, I have a sentence that says, meditation, not medication, saved my life in 2015. And I'll tell you, it did. Because I had this at one point my sed rate was 70, I might have mentioned. I mean, just this, outrageous inflammation, this outrageous, and really I had no medication for, it was 10 months that I was finally given prescriptions for steroids and
Wow.
hydroxychloroquine. There's not one FDA approved medication for Sjogren's, the systemic symptoms of Sjogren's. So there are some in the pipeline, and I'm understanding that maybe, another 3 to 5 years out at least. Or there's two in the pipeline, I should say. So really just trying to take good care of myself, vitamins, supplements, eating, sleep, um, and again, I have trialed multiple different medications over the years, but
Yeah.
nothing regular that I can really tolerate.
That's so frustrating that there aren't more medication options, and that's why when I do a lot of patient education around rheumatoid arthritis, I try to kind of highlight that the patient population is, in my opinion, lucky to have access to so many, pharmaceutical options that can be really, really effective. And but back to Sjogren's, in terms of meditation, how did you learn? Like, did you go through a program or?
Yeah, interestingly, I before I got sick, I thought I knew about meditation, but I can tell you I did not until I was laying on the couch and couldn't get off the couch because of my physical symptoms. It threw me into this, this kind of concept of like you need to figure out something here, like you're gonna, like, I really thought I was gonna die. And I felt like I had to go back in my roots as a chiropractor, so this holisticness, and thank God I had that to go back on. Okay. Let's just say that. But really, people will say to me, well, how did you meditate? Didn't you like have all these thoughts going through your head? And yes, I did. But honestly, that was the only thing that actually made me feel a little bit better, was putting myself into very deep meditative states. And in these meditative states, I feel like I was actually able to just connect with, you know, my soul, like the deepest part of me as a human being. And honestly, I would have never been there without this illness. Never. I was really living on autopilot, and I thought that I knew happiness and really, but I wasn't grateful for things before I got sick. So, I feel like it's been this whole cycle of, just really just I learned so many things about myself. So, and I think that's where the peace comes in. Living peacefully amid chronic disease is so difficult, and it's different for everyone. But for me, it was acceptance, which was really the real journey.
Yeah.
It was acceptance, and it was also transformation. So transforming this to, well, now I can help people. Now I can actually make good out of this. So, you know, there's some positivity to my suffering. Really the positivity really outweighs the suffering that I had.
And well, you've touched on my favorite word, which is acceptance, which used to be my least favorite word. So, I love that, and I think, yeah, turning. I once heard this phrase. I wish I knew who to give credit to, but turning your pain into your purpose is something that I think, yeah, taking what you've been through and making something productive out of it. In your book. By the way, I want to make sure to say the name of your book: "The Girl on a Gurney Trading My White Coat for a Hospital Gown." Right? Okay,
That's
got that.
correct.
Yeah, such a great
Thank you.
title. Um, and do we have a date when it will be out?
No, but if
Okay.
your audience members go to my website, I will be putting updates there, and I have a newsletter subscription, and I will definitely be sending out updates, but hopefully by the end of next year, and which is really exciting.
Oh, that's exciting. Yeah, very exciting. Yeah. And I know that your book is going to help so many people. Hopefully it will be one of those books that gets recommended in, medical schools as well. But yeah, thank you for sharing about the meditation. I was always like, I can't meditate because I am a high energy person. I don't like to sit still. And learning, okay, wait, it doesn't just mean sitting still and being peaceful. It means being present with whatever you're feeling and taking, breathing through whatever you're feeling. But it's been really, really helpful for me as well. So for anyone skeptical about meditation, maybe after hearing us, you might want to give it a try.
Yeah, absolutely. And really, being mindful, right? So it could just be going to your cupboard and, taking out your favorite spice and just kind of, just whiffing the aroma, and how does that make you feel? And
Mhm.
really, just and again, it's different for every person. But really these healing meditations that I still do every
Yeah.
day
Oh, wow.
really just are so powerful.
Do you have any recommendations of like books or websites where people can learn more about meditation and mindfulness?
Here's the thing, and again, people ask me this, and I really just, truthfully, once I quieted my mind down, I was just able to just visualize and
Mm.
and I don't do any guided meditations, really. Once in a while I do, but mostly I just do self-guided. But I
Uh-huh.
do want to say The Power of Now,
Yeah.
by Eckhart Tolle. Oh boy, right. So you have to know his quote about acceptance of the unacceptable is the
Yeah.
greatest source of grace in this world.
Yeah. Yes. Oh,
And
wow.
he talks a lot about meditation and just really just staying in the moment.
That's yeah. A lot of people that are in my Room to Thrive groups also swear by like either if you need more guidance, like the Headspace app or Insight Timer, those come up a lot as recommended, like guided. I like to have guided personally because my mind wanders a lot if I don't have guided at this stage. Maybe in the future I'll be better at self guided.
I know, I
But
was talking to a friend of mine not that long ago, and she's like, "You really don't do guided meditation?" I'm like,
I know.
"Not that often."
Yeah. Well,
But
yeah.
I it took a lot of practice, believe me, a lot. But when you're laying there and you can't really do anything, then you kind of have time to, um,
Yeah. Yeah, and we have a couple of rapid fire questions before we wrap it up. One of mine, I wanted just to add this one in, but I think you've I mean, I don't even know what the answer to this for you would be, but if you were if you were having the symptoms that you had before you got diagnosed today, what would you do differently?
so I will say that I did have some self-doubts here and there, okay, because I think part of that was also a little bit of the manipulation from,
Mhm.
my primary care provider, who was telling me, "You need to take this antidepressant, you need to go on vacation," you know, so what I did was, when I had, um, my worst symptoms, then I would go get labs, and obviously the labs they would correlate to my symptoms. So yes, okay, my SUD rate's 60, and I feel terrible. Or if I felt a little better during certain times, then yes, okay, now my SUD rate's 45. So I think that's self-doubt. So I would eliminate that.
Mhm.
And again, I didn't have a lot of it, but honestly, even just to really, um, you know, not have had to, run and get labs, like, just to kind of prove to myself objectively, no, listen, this is the data.
Yeah. Yeah. I mean, yeah, that makes a lot of sense. Do you have any words of wisdom for newly diagnosed patients, either with Sjogren's or a similar condition?
Sure. I think really release the expectations of what you think your life, what you projected your life to look like. And that was huge for me. And, um, I actually, when I lecture to the students of medicine too, I tell them, like, what you picture your life to be, it may end up being very different, just like mine. So
Yeah.
yes, so I would say to newly diagnosed patients, really, don't compare yourself to others. Really
Mm.
release the expectations and know that there is going to be a learning curve,
Yep.
until you find that balance, okay, of what you can do with your routine. And there may be times when when that balance is definitely definitely changed depending on flares, and just being, I guess, acceptance of the the unacceptable, and really the uncertainty.
Yeah. Oh man, you're hitting on my
It's just
favorite.
so hard.
Yeah, it's so hard. And when I think when you say, release the expectations of what you projected your life to look like, I would say that reminds me of this concept of what is a normal life. Because a lot of people say they're trying to be comforting to patients and they'll say, oh, well, you can live, let's say with rheumatoid arthritis, where there's all these good treatments, you can live a totally normal life with rheumatoid arthritis now. Like that's how they define what hope is like basically living a life indistinguishable from someone with a chronic illness. But in a way, that's kind of like a form of subtle ableism, right? Because you're saying like a life without chronic illness is like the norm, that's normal, and that's what I want, right? And that's the best life to have, so
Right.
versus, saying like disability is the only, what do they call it? Disability is the only minority group that anyone could be part of at any time. Like your life could change in an instant. Nothing will protect you from it. Like no amount of good eating, exercise, meditating, it can happen to you at any time. One cell in your body could decide to go rogue and, so sorry, that's my little soapbox, but saying that, that doesn't mean your life is over if you have chronic illness.
Right, exactly. And I just want to also say, having a medical degree also, it doesn't, that's not going to protect you
Yes.
either. This white coat is not going to protect. Um,
Mm-mm.
but no, absolutely, it is. It's so really, it's hard, and you have to find, kind of your individual piece. And according to the CDC, over 60% of all U.S. adult Americans have at least one chronic illness, at least
Wow.
one. So we really do need to reimagine chronic disease and disability in this country. We do. And it starts with
Yeah.
society. It starts with really a respect for everyone. So everyone needs to be treated in an equitable manner, right? Everybody needs to be treated
Hmm.
equally.
Yeah.
That's where it starts.
100%. On a different note, what is something that's bringing you joy right now? Doesn't have to be related to Sjogren's or anything, like literally anything.
What's bringing me joy is really knowing that that I have taken this difficulty, and I'm really have made it into a triumph, and really helping others, makes it a blessing. And I really feel like if I can just help, one other person just avoid the suffering, that extra suffering that I had through medical gaslighting, really it's just all worth it.
I feel like if I could give you a handle on Instagram, it would be like anti-gaslighting crusader. I wonder if that
Thank
one's
you.
taken.
I love it.
Little social media advice on the side here. Okay. Yeah, let's look it up right now when we're done. Okay. What is it last? I love that. I love that. And what does it mean to you, last one, to live a good life and thrive with rheumatic disease? I think Sjogren falls under that an umbrella of inflammatory autoimmune, immune rheumatic disease.
Exactly. And I think just finding the good in the little things, just living a life of gratitude, which, and, again, I want to say I was not a total jerk before I got sick, but honestly,
Oh.
I just had no clue. Like I just was just on this automatic pilot, and, but really just being grateful, like, okay, like I was able to get a shower, by myself. And, I'm just
Mhm.
so grateful for all the things I am able to do. And really just finding the little things, you know, um, just honestly, just finding the little things in everyday life.
So true. You really don't appreciate those like until they're taken away, till that ability to move through the world with ease is taken away from you. So I love that. I think that's good advice to anyone listening. And I'm gonna put all these links in the show notes, which are on my website, or if you're watching this on YouTube, also there. But to your website and your YouTube channel and everything. But where can people find you? Where do you want them to go?
Sure. I think my website, www.rebeccahosey.com, is probably the best way. Then there's links to to my social media pages that way. And also I have articles that are on there, and other media, webinar, other things that they can watch and listen to and read.
That's so great. I really hope that this I think that there has been an upswell, if that's the right word, of awareness of medical gaslighting in the last, few years, and with long COVID and the increase in incidence of autoimmune conditions. I'm hoping that there's even more and better, understanding of this phenomenon so that we can make it reduce in frequency. So thank you for everything that you're
Great.
doing to help others not have to go through what you did. Because that was, like I said, I'm not playing, I'm not trying to say like, everyone's experience is horrible if they've gone through medical gaslighting, but the degree to which you were explicitly told, like, I will not help you because you're not sick is just ridiculous. So if I were you, I'd be like, I'm never talking about this again. It's so stressful. Like, so thank you for taking on the emotional labor. It takes time. You're taking time out of your day to share this with me, and you're taking time to share it with the medical students and with your books. So I appreciate that. I'm getting like stressed. I'm feeling my armpits like sweating thinking about your story. I'm so frustrated for you. So I can't imagine what you're feeling like reliving it, you know? You're
Well,
like,
thank you for that validation. I appreciate that.
yeah, yeah. Oh my gosh, no problem. And I'm working on, I got this comment on my YouTube channel that like I interrupt people too much. So I apologize. I had to a few times be like, ah, I can't believe this happening to you. I cannot believe it. So
No,
again,
it's fine.
yeah, thank you again. And hopefully we'll catch up soon. And if everyone could check out again, Girl on a Gurney, or RebeccaHosey.com is the website, right? I'm looking down at my notes. Yep. www.rebeccacca, HOSEY.com. Okay. Bye-bye for now.
Thank you. Thank you for having me.
Bye.